Everything's growing, changing, and evolving, even you. From the student nurse to the baby nurse, the veteran nurse, off the bedside into entrepreneurship, you have arrived and you have evolved. So, welcome to the Evolved Nurse Podcast. I'm your host, Keish, and this is another episode. Y'all, I have not seen y'all in like 2 weeks. And why? Why have I not seen y'all? So if you watched the last episode, you know that I had a tea party for healthcare professionals. And so I was pretty much bouncing back from all the work of doing that and also being in DNP school and trying to balance that, being a mom and all of the things. So I had to press pause on coming to see y'all for a week or so that I could recalibrate myself. Because honestly, I was tired. Like I'm just now feeling a little bit more up to my normal self, but for the most part, like working day and night to try to get this event to be what it was and doing all the things, y'all, I was tired. And so now I'm back. I'm back and I'm better, but some of the things that are going on in nursing right now are some of the things that we need to talk about, but I don't necessarily want to talk about them first. I kind of want to talk about them in a few minutes because I'm going to talk about the tea party itself. So if you are listening to me audibly, audio wise, on any podcast platform, I'm talking about Spotify, Apple Podcasts, iHeart, um, anything, any place that hosts a audio podcast, 9 times out of 10 the Evolved Nurse is there, baby. The Evolved Nurse is there. But you can also see me on YouTube. So if you're watching me on YouTube, you'll be able to see all the inserts of the videos that I put in and the edits and stuff. So come over to YouTube, subscribe, like, review. If you want to keep seeing me do certain things, you can also go follow me on Instagram. But aside from that, let's get into it. So, y'all, I did, in collaboration with Soulful Sis, who did our herbal tea experience, a tea party for healthcare professionals. So it was called the Evolved Sis Wellness Tea Party. And it was such a beautiful experience. But the work that was put into it, y'all, let me tell you, that's why I ain't been here with y'all, because the amount of work that I put into just going hard so that my panelists were great, so that our gift bags were wonderful, so that the experience was nice, the music was nice, everything about this event was nice. But in the beginning, I did not know that was going to happen. So let me take you back, okay, to my first thoughts about the tea party. So I'm a tea drinker, right? So I've had the Evolved meetups two times last year, and this was our third official meetup. So the first time I had given gift bags. It had tea in them. Y'all know I love tea. I'm a tea drinker. And then the second one, we did a bookstore meetup, and then I did a little cute wrapped up because we did a book swap out. So I wrapped up the books that I gave, and then I put some marigolds from my garden in there, and I also put some tea in there. Again, tea, because again, I'm a tea drinker. But all in all, what I found was that I love tea. And in nursing, in anything, like the world that we live in, you require some peace, some calm, some serenity, some joy, some happiness. You deserve all of that. But a lot of times we don't get it. And because we work such crucial jobs, it's hard for us to even find the time to even just sit down and rest. So that's what I wanted to do. I wanted to create some relaxation within the groups that we have, because I think that it's very, very important. Now, what I can say is, y'all, while the people who came were relaxing and having a great, I was tired, y'all. And y'all probably didn't even know it. I was tired. Up to the last minute, I did not have my clothes on. I had to run to Publix real fast after I decorated the studio. And walk in with my head down, with my clothes in my hand, and get dressed in the bathroom. But initially, I did not know that it was going to do as well as it did. We made it very intimate. We had 10 general admissions, 10 VIPs, and then we had our panelists, which was a total of 25 to 30 in house. Unfortunately, some people couldn't make it. Shout out to my cousin. She missed her flight, y'all. As a matter of fact, I gotta go mail her VIP bag today. I'm gonna make sure I mail her VIP bag today. But she didn't make it because she missed her flight, and that goes to show how much we do as healthcare professionals. Like, we love to show up for each other, but sometimes we need to rest. So when she told me that she missed her flight, it was like, girl, go have fun, go sit down and breathe, because we do so much. Like, the working, the showing up for people, the making sure that everybody is taken care of around us, and we're not taking care of ourselves. So that's what we have to do, and that's the space that I created for the Evolved meetups. Is that we sit, we talk, we break the ice, we feel like we know each other, and then we can get into some other things. But all in all, if you want to vent, you can. If you don't, you don't have to. But the type of space that the Evolved nurse has created for healthcare professionals, I am extremely proud of the space that um, it has created, because it wasn't just me. It's the people. It's the people who've poured into us. It's all of the things. And so how the Evolved Sis came into play was that, so me and Kaneda, the Soulful Sis, she started, her and her husband, they have a landscaping business. So go shout out to Charlie Bravo here in Jacksonville, Florida. Go and see them. He also did my grass, and then she helped me on a revamp of my struggle garden. So if you don't know what my struggle garden look like, go to Instagram. Go to Instagram, scroll down my page, you're gonna see my struggle garden, and you're gonna see what it looked like. And it's struggling now a little bit because the winter killed some of the plants that are annuals, but or whichever one they are, it killed those also. Now it's time for me to replant. But we were talking, and she was like, we should do a tea party. And she was like, I can do the tea experience. And so she did the tea experience. She led that, and it was beautiful. So many women came in, and she had them working hard, y'all. She had them working hard for the money, because to get those whatever those berries are, you'll see. I'm gonna place a clip over here of them working hard and trying to get it done, child. But all in all, it was such a beautiful event. We had so many sponsors. If you've been following me on Instagram, you have seen all of our sponsors. Um, Yoni Potion, who also sponsors this podcast. And you're gonna see a sponsor from her later on, Mac. This episode of the Evolved Nurse podcast is brought to you by Yoni Potion, the natural wellness beverage crafted for women by women. Ladies, let's be real. When it comes to health, we often put everyone else first. But here's the thing, your body deserves care too, especially when it comes to something as important as your vaginal health. That's where Yoni Potion comes in. It isn't just any health drink. It's a natural game changer, made with natural ingredients like pineapples, ginger, apple cider vinegar, and more. It creates a natural probiotic for a healthy microbiome. Yoni Potion helps you maintain balance from the inside out. It's all about keeping your pH levels in check, supporting hormone health, and helping you feel comfortable and confident in your own skin. Oh, did I mention it was delicious? Whether you're hitting the gym, powering through a busy workday, or just need to pick me up, Yoni Potion is there to keep you feeling your best, because when your body feels good, you feel unstoppable. So if you're ready to embrace your health and take charge of your wellness journey, head over to yonipotion.com and check out Yoni Potion. That's YONIPHOTION.com. Listeners can get 10% off using code POTION, P capital H O T I O N 10 on your first order. It's time to treat your body with the care it deserves. Yoni Potion, because wellness starts from within. Now back to the show. Innate Beauty, the right medical solution. Gorgie, the tea caffeinated energy drinks. We had Dosa, which is a great body product. Herbal. Let me go. I gotta go and find my peoples. Okay, I gotta go find them because I want to make sure they get the recognition that they deserve. Because a lot of my products were for the free 99. They just shipped them, and that was it. Like, no questions asked. They just sent the products, and I completely appreciate that. So then we have Angel Assisting, that's also Kaneda. She did a lot of printing for the event itself. Affirm. Affirm is a practice here in Jacksonville, Florida, and it's on a subscription based. This is when I talk about subscription based, I would like for somebody else to talk about it in depth, but the gist of it is you pay monthly $99 and you get full access to your primary care physician. That means that you get discounts on lab work, images, as well as having unlimited amounts of exposure to your primary care provider. So it's not like going to the doctor and you only seeing them for 15 minutes. You actually have time to sit down, talk to your doctor, and let them know what is going on, what's wrong with you. You don't have to just limit it to my knee been hurting, because that's what I told you was going on when I entered today. But you can also let them know what else is going on. Let's see who else. TX Herbs, we cannot forget her. The signature tea was a banger, y'all. Everybody loved the signature tea. We had honey and sugar for them if they needed it. But once you're a grown tea drinker, sometimes you don't utilize those. But sometimes you want a little sweetener. It was amazing, amazing. I still have some. Black Prince. As you know, I have her planner, as well as the cups, the teacups they're coffee cups, and it says straight black coffee, and it has a cap on it and a spoon, y'all. A cap and a spoon. Okay. And then, of course, we had Black Girl Vitamins. We cannot forget Black Girl Vitamins. Down in the description box, you will see a link, and you can get 10 to 15% off of your first purchase with Black Girl Vitamins. If you do not know, they created their vitamin brand because Black women are deficient in certain vitamins, and we don't know anything about it. So they pinpoint those and they help us out with that. They also have packages that you can get, whether it's energy or whether it's strengthening, all of those things. Go to Black Girl Vitamins, check them out, and then use my code so that you can be able to get some little money off of there, okay? Then we have Color Club Magazine. That is a cute magazine, and they sent us magazines as well. Those were in the bag. Sandstorm Beauty, they sent us some body oil that smells so good. What is called Auntie Peaches. Baby, it smells so good. And then I said hi tea skincare. Good Wipes. I'm sure that you probably seen Good Wipes in big box stores, but they also were a sponsor. And then Foaming Skin. Y'all, we cannot forget about our wonderful chef, Chef Lindo. He did the thing with the food, y'all. And Chef Lindo is also synonymous with Charlie Bravo, who did my grass, who is also Kaneda's husband. Okay. But yes, had a very, very wonderful time. I am so glad that I created a space, that we created a space that led to so many great relationships, that led to so many people feeling involved, cared for, supported. Y'all, when I tell you, we had so many different healthcare professionals in the building. We had dental hygienists, we had students who wanted to be a nurse, we had of course nurses, pharmacists, pharmacological scientists. We also had our financial guru in the house. We have our certified gut specialist. let's get into the wonderful panel, y'all. This was the panel. The panel was comprised of myself, who was the host of the panel, Waylene Charles, who is a CPA, real estate agent, tax consultant, all the things. And we had April Blue Mosley, who is our gut specialist, who talked to us about how we get our guts right, because if your stomach ain't right, you ain't right. Okay? If you're feeling things in your stomach, it's time to get checked out. We also had the Zulu nurse, who is also Patso, who is the owner, founder of Yoni Potion, who also sponsors this video, as well as Dr. Candace Airline, who is a pharmacist, and she talked about the collaboration between Western and Eastern medicine and how it related to her. And then, I spoke about mental health and how it affects us in the healthcare profession, and how we navigate those things, how we navigate speaking up for ourselves. But y'all, when I tell you it was such a beautiful experience, I do not know how to thank those women anymore. I look for forever indebted, forever indebted. Oh no, oh no, not R. Kelly. Um, but really and truly, those women spoke to and interacted with and mingled with and did not waver or make anybody feel uncomfortable. The space that I was attempting to curate as the evolved nurse is a space that makes people feel comfortable, because we're often uncomfortable in so many situations, and you see that now with all the things that are happening, and we're gonna get into that in a few. But creating a space that allows for nurses, healthcare. See, at first, y'all, the evolved nurse was strictly for nurses. And then I started bridging the gap. And once I started to bridge the gap, because I learned a long time ago with going from department to department, doing externships, seeing what I really wanted to do. So I started very early. And so this is for anybody who has young children just about to go to college, these are some of the things that they can do to try to figure out what they want to do. When I was an undergrad, our director did not push for med school, and we were biology majors. So all of us had a plan to either go to med school, be a PA, go into dentistry, be a pharmacist. All of our plans were to go into the medical field. But my PWI, which was an agricultural school, was strictly really research based. So anything that we would do would be research based. So we went to our director and we were like, "Hey, are there any opportunities for medical professionals?" As like when we look at the business school there, they have externships, they have internships, they have paid internships that they can go to, and we had nothing. We had nothing, and he literally looked at us and he said, "No, y'all are really going to have to do it by yourself." And that's just what we did. We went to, me and my cousin, who I was talking about earlier. We went to the hospital. We signed up so that we could do shadowing days to see what we wanted to do. We went to multiple shadowing. We did sports medicine. I did GYN. I did mama baby. I was in the OR. This was all while I was still in my first undergrad career. So I had no idea that I was going to be a nurse. So I'm in there and I'm trying to figure out what I want to do. Do I want to go to med school? Do I want to go to PA school? PA school was really what I was strongly going for. Took my GRE, all of the things. But then I started to think, like, once I was shadowing, how the way that PAs just didn't have the time to talk to their patients, or they just didn't have the time. They had to get in, get out, get in, get out. And that for me was not something that I wanted, because I was going into healthcare because I wanted to help people. So I wanted to learn the story. And that's when I found Dr. Lakeisha. And I feel like I may have talked to y'all about this in another episode, but I saw her in Lowe's when I was working in Lowe's, and somebody else that worked at Lowe's with me also worked at the hospital. He said, "Hey, there go Dr. Lakeisha." And I was like, "Oh, okay. Do you think she'll let me shadow her?" He was like, "Yeah, go over there and talk to her. She real cool." So I went over there, I talked to her, and she allowed me to shadow her. When I shadowed her, I saw the difference between a nurse practitioner and a PA. I didn't completely understand the difference at the time because, of course, I was ignorant to pretty much anything in the medical field. I'm just trying to figure things out, figure out where I'm about to go because it's almost time for me to graduate. So we need to figure this out now. Um, but all in all, what ended up happening was I decided that I wanted to go to nursing school. And she was like, "If you go to nursing school, I'll write your letter of recommendation for you." And she wrote me a letter of recommendation. And so, with that being said, like, you may have to let your children know if they want to experience more, they can go shadow. Even if they're in high school, they can go volunteer. A lot of the hospitals are allowing high school students to volunteer so they can see what they want to do, especially in the summertime. Sign them up, let them go see if it's something that they want to do, if it's something that they feel like they're passionate about, because they can find out very quickly whether they want to do it or not. They don't have to wait until they're 30, 40 years old and realizing that this is something I really didn't want. I really did not want this. So, yes, make sure that you're creating that space for them, because honestly, with me, I would have thought that my school would have supported us wanting to go to med school. A lot of us are, I think in my cohort, we have two doctors, a veterinarian. I think two of us are nurses. Then we have a PA. Then we have a AA. Then we have somebody who is in med school. So these are all professionals like that have gone through this program, and it did not set them up for greatness. We had to like figure it out. Some of us are just now figuring it out. Some of us are just now going to med school. Some of it, like, we are just now figuring it out because our program did not set us up for success when it was relating to the medical industry. And that's where we wanted to. Why would we be in a biology program on a medical track if you are not going to set us up for greatness? So we just had to do it ourselves, and that's what we did. Um, and I will say that if you have kids who are in high school and you listen to this and they have the time, help them to get volunteered with your local hospital. Just go to HR and say, "Hey, do you have any volunteer opportunities?" And 9 times out of 10, they will allow you to volunteer. So because they always need somebody else. They may need you to help with the CNAs, and then you probably can like integrate into being a CNA, LPN, RN, or CNA, RN, or you can see that you like it and you're like, okay, I'm just going to go to nursing school. So it's really whatever you want to do. But going back to what I was talking about before, curating a space for nurses to feel wanted, for nurses to feel like they belong. But in me going from department to department to department, I think the beauty of having an externship, and y'all, if you go to my theevolvenurse.com, I do have a free ebook called How to What I Wish I Knew About an Externship. Go and get that, because my externship taught me so much about so many departments, and that's why I have empathy to other departments. So if the emergency department send me up somebody and they ain't completely clean, okay, that's fine. I know what they're down there doing. I know that they have patients that's rolling in. I know what's going on. I'm not feeling like, oh, why would they do that? Because the reason why other departments do that to each other is because they don't find value in the other departments. And it's really because they don't know what all the other departments have going on. They're just thinking that you're sending them up. The emergency department is focused based. They're not going to give all the meds. And if they do, be grateful for that. But if they don't, look at it as it's time for me to get my patient. And vice versa. When you're getting, now, like I said on my last video, don't be giving these raggedy behind reports. But all in all, understanding and knowing different departments. I have been at home health, which I really like. Home health, OB. I was in the OR as an extern as well. When I went to the OR shadowing, I hated it. I was like, it's stank in here. Like it smells like flesh in here. Like it's cold. I'm not doing anything. But that's really because you're not doing anything. Because when you're shadowing, you're really just looking. You can't touch anything. You don't know where anything is. But when I went to my externship, they actually tried to, offer me a job. They were like, "Oh my gosh, you do such a great job. Whenever you get out of school, you should come here." And just so happens the externship that I was in did not call me for my interviews. And I had to call them and I was like, "Hey, what's going on?" And so home health and OR basically told me that I had a position with them to just let them know. But because I felt a little slighted, I was like, "Why didn't y'all call me? Y'all called everybody else for their interviews. Why didn't you call me?" Um, and they were like, "Oh, go ahead and do your interview. You don't really have to do an interview because home health wants you. And so you can just go ahead and talk to them and blah, blah, blah." But at that time, I was like, I had already started putting in other applications because waiting around during that like gray area of you just passed your NCLEX and now you're trying to figure out life. So you're already putting in job applications after job applications after job applications for residencies. So I had already gotten a residency in Tallahassee. And even with that, like I went there, it was nice, and then I looked at the housing prices. I was like, okay, this is high. This is high for the area. Not Probably not because FAM is there, FSU is there, all those things. This is college town, so I was young, okay. But when I saw the offer for here, they called me. I was outside. I'm like, hold on, they calling me. I didn't know that I had got in. They called me. They offered me the position, and it was more pay, and it's cheaper here than it is there. So I ended up coming here. So understanding and learning the different departments is what allowed me to create the Bridging the Gap series. Because y'all, why not bridge the gap? Why not bridge the gap so that we can respect each other more, so that we can give each other some grace, so that we can create better patient care experiences? Because a lot of times y'all in there arguing on your voceras, arguing on your voceras about what somebody did not do, not understanding all the other stuff that they had going on. So that's why I created the Bridging the Gap series, and that's what opened up the Evolve Nurse to healthcare professionals instead of just being nurses. And it's just to create a safe space because we need one. Y'all, we need a safe space. And it's not easy. It's really not. But I'm going to show you some clips of the Evolved Nurse, the Evolved Sis Wellness Tea Party right here. So, y'all, I think that it was a very beautiful, beautiful experience. And will we do it again? Stay tuned. Follow me on Instagram. Follow me on TikTok. Join my Facebook community called The Evolving Nurse. And also follow me on YouTube. I'll keep updating my community page for you all if you're watching on YouTube. But we're going to get into some of the things that are happening in today's society when it's related to nursing because, baby, it make you want to get off the bedside because there's no protection for nurses. And I'm going to use... Hold on, y'all. It's been a few situations in nursing, and I waited to the end of this video because y'all, it's heavy, and honestly, we're not gonna talk too much about it. So we have one nurse who was held hostage and was forced to zip tie other people. Okay. I'm just gonna tie this all together because we about to just get into it. We had one nurse who was beaten by a... Y'all, I'm sorry. All right. So let's get into it. I gotta gather myself because this is really heavy. We had one nurse who was beaten really, really badly by a patient, then who was a Baker Act patient. Then we had a nurse who was held at gunpoint and forced to zip tie her coworkers. We also in the news cycle, y'all. Oh my gosh, what's going on? I'm sure this stuff happens um in other places, but we got people who throwing urine on nurses. We have all of this stuff, y'all. And then on top of that, let's talk about the outbreaks. Y'all, we have multiple outbreaks right now, and nurses should not be the ones to be educating the community, but we are. We're educators. Okay, so we have a measles outbreak right now, and let me see, I think it's in is it in Texas? In Texas, it's a measles outbreak. Then we have a tuberculosis outbreak in Oklahoma. These are things that we have to watch out for. And as nurses, as CNAs, as healthcare providers who are in direct patient care contact, y'all ain't at home behind the computer giving care. For you all, I really want y'all to stop going work sick. I really want y'all to stop going to work sick because y'all, when I tell you my baby is staying sick because people are coming to my job sick. And it is not fun. It's not fun walking into work and seeing somebody putting other people's kids' lives at stake. Y'all, I want to show y'all a little picture of my baby today. Look at him. Look at him. This my little baby. But yes, really and truly, and then y'all look at him. Art, big artist right here. Um, but really and truly, we have to make sure that we're taking care of our children. And I work in peas, and so that is our specialty, is to make sure that the kids are okay. And so stop going to work sick. If you know something is wrong, don't go, please. But this is me just deflecting, right? Because we got to get into it. Um, Nurses not being protected. And I'm sure it could happen to other healthcare providers as well, but specifically nurses, because we have more one-on-one direct patient care and contact with patients. We are their liaison to the doctor. Sometimes we're their liaison to the pharmacist, and when it comes down to it, they see us often, and a lot of times they don't know all the other things that we have going on, but that can create anger in patients. And it is not okay for patients to ever assault nurses. But I did see where the woman who was beaten, her administrator called 911, and then this could be false, this could be fake news, but in the 911 call, she was like, "Hey, I have a nurse who's been beaten, um, and she's unconscious, but I'm not worried about that. We need to get this Baker Act under control." Let me sit up. What is wrong with humanity, and what is wrong with these directors, these administrators, these managers? Y'all lack so much empathy to be in a position to where you're supposed to be caring about your employees' well-being. Let's get into it. So, as I am on my journey in my DNP role, I do not have my doctorate yet, but the more and more that I get deeper and deeper into my journey, I'm learning more and more about management. And one of the biggest things about management is that we need to make sure that our employees are taken care of. And in taking care of our employees, it takes care of the business. Because we know that nursing, the hospital, is a business. They don't really normally look at you as people, but they should. Because not only does poor work environments increase the amount of insurance that employers have to pay into, it also increases the amount of times people call out, the amount of times people get sick because they are stressed out about this job. Okay, y'all leading people to having strokes. Y'all having people have strokes, heart attacks. They don't want to come into work. They are coming into work sick because they don't have sick days. They are coming into work sick because y'all making them come in sick. Let's be honest, y'all are making people come in sick. Y'all are making people y'all are making them. Y'all are guilting them into coming in. Y'all are saying, well, your team is going to miss you. They need you. Well, sometimes you need you. So take care of you. But to see that this manager said this, I hope that they are fired. And I hope that it is on their record for how they treat people and how they. I need for them to be able to tag a license and say they don't care about people. It need to be a license tag. Like, this person don't care about people, so they don't need to be interacting with people. And mind you, a lot of people are in the business of healthcare, but they have never been in healthcare. So they're not thinking about it on a clinical level like us, but they're thinking about it on a money level like them. And that's not fair, because guess what we have to do? We have to think about both aspects. Most times in a manager role, you have to think about it in both aspects, because you're still doing clinical work, but you're still like in the managerial duties of the day to day. But you also have like your directors, your administrators, your hospital DONs. And with that being said, you have people who just have a disconnect from what nursing is, because some of them have never been nurses. Some of them have never been nurses, they've never been healthcare providers. They are just business sharks. And that is fine for the business portion, but you have to understand how to manage people. People are very sensitive. You have to make sure that you're taking care of them, that you're creating great work environments, that you're making sure that they feel open to come and talk to you. All of these things so that you can have a great like, you won't have that huge turnover rate that you normally have if you treated your employees right. A pizza party ain't enough for being beat on, spat on, urine being spilled on you, guns, pums being put to your head. That is not worth it. It's not worth it at all. And guess what they're gonna do? They're gonna not address the issue. They might give them an EAP or some type of therapy at some point. They may give you 2 or 3 or 4 free visits to a therapist. But outside of that, let's talk about mental health in the healthcare field. I just recently asked my A&M, hey, is there do you all debrief for anything after an organ procurement? So as you know, I'm in peds, right? So when we have organ procurements, that means that there are children who have, either unalived themselves, been unalived, or they passed away peacefully. Some of these children that these nurses see are them. Some of them struggle with mental health coming up as teenagers. Some of them didn't have appropriate family homes. Some of them went through abuse as children, and they are triggered. And when I asked my A&M that, she was like, oh, they have the option to, talk to the chaplain. I was like, do y'all prompt that? She was like, no, it's just on them. It's just on them. When right after this organ procurement, you're sending them into another room to start doing something else. And then they have to do something else. And then they have to do another room. And then they have to give a break. And then they have to do all of this. You have to make sure that you're taking care of your employees, because once they get burnt out, the efficiency plummets. Efficiency plummets because they don't care anymore. They do not care anymore. So I really think that it's very important for y'all to step your managerial game up. If I'm being honest, and I know that it can be hard because managing people is not easy, but you need to manage what's going on in the day to day so that it can trickle down to the people, and then manage the people. But you have to make sure that you're creating systems that allow for them to be great. If you're not creating those systems, if it's chaotic, if the system is too complex, you are not going to get what you need out of those people. And you're going to keep seeing high turnover rates, keep seeing new CNAs, or seeing ineffective CNAs. You might see that there's a CNA that's not working a lot, but the nurse is getting burnt out by doing their job for them. They're not saying anything because it's the culture that you created within the hospital, or it's the culture that you created within the long-term care facility. So you have to make sure that you're doing all these things to create great work environments, because things like this should not be happening. There should not be someone who is able to beat that lady like they did. And I'm keeping it real light because it was real heavy. But yeah. Nobody should be able to do nothing like that, y'all. Like, human decency is one thing, but protecting your employees is another. And I know my hospital has a no nonsense policy for patients. So if you do some raggedy stuff, they send you out the door. And you have one time. But some facilities do not have that. And I'm not saying that my facility is the best, but what I am saying is that they did implement that. And it wasn't always that way. But it will take a lot of change to see things change. It'll take a lot to change it. And honestly, you just have to find great managers that will make sure that their people are taken care of, because your employees being happy creates a way better work environment. And so with that being said, y'all, that's the end of this episode. I hope that y'all have a great day. If you made it to the end of this episode, you can email me at theevolvednurse@gmail.com. If you have any questions, concerns, or anything, if you are looking for somebody to mentor, talk to you, you can definitely reach out to me. You can find me on Instagram at The Evolved Nurse, and you can also join the Nurses Evolving community. Y'all have a great day. This is The Evolved Nurse signing off. Bye.